Namaskar. Today we'll study bacterial resistance to sulfonamides. Sulfonamides are the antibacterial drugs. Before antibiotics, they are the only drugs which were having antibacterial actions. And way back in 1908, they were discovered first. Um, until penicillin discovery, sulfonamides are the only drugs having antibacterial action, and these drugs show resistance to. Before discussing resistance, let us see how these drugs act, the mechanism of action of sulfonamides. And sulfonamides are competitive inhibitors of PABA. Because of their structural similarity with para-aminobenzoic acid, they competitively inhibit PABA and hence inhibit folic acid synthesis. And PABA is required for conversion of dihydropteridine diphosphate to dihydropteroic acid in presence of the enzyme dihydropteroid synthetase. And dihydropteroic acid in presence of glutamic acid and folate synthetase forms steroyl glutamic acid or folic acid, which on reduction forms dihydrofolic acid, which on further reduction forms tetrahydrofolic acid. And tetrahydrofolic acid acts as a coenzyme for the enzyme thymidylate synthetase, which is required for the conversion of deoxyuridine monophosphate to deoxythymidine monophosphate. Deoxythymidine monophosphate is required for DNA synthesis, and hence this is required for bacterial growth. So in this way, folic acid has a role in bacterial growth, and the sulfonamides inhibit folic acid synthesis by competitively inhibiting PABA. So this is one, and sulfonamides are used in combination with drugs like trimethoprim, pyrimethamine, which are this trimethoprim and pyrimethamine inhibit folate reductase or dihydrofolate reductase. So this combination is also there. So when we study this resistance, these things need to be considered. So let us see the mechanism of resistance of sulfonamides. So when there is increased production of PABA in bacterial cell, bacteria will show resistance to sulfonamides. Why? Because there is competitive inhibition of PABA by sulfonamides, and if sulfonamides will be more, then it will be the substrate here, and if PABA will be more, then it will be substrate here for this enzyme dihydropteroid synthetase. And when there is more PABA, usually in presence of POS, because POS contains a large quantity of PABA, sulfonamides become ineffective. Why? Because POS contains a large quantity of PABA, and some sulfonamides cannot compete with that large quantity of PABA, and PABA binding will occur usually, and sulfonamides fail to act. So this is one mechanism of resistance: increased production of PABA in bacterial cell. And similarly, some PABA like sulfur drug antagonist can also be produced by bacterial cell. And if there is decreased bacterial permeability to sulfur drugs, so suppose this is bacteria, and the bacteria may develop a mechanism where the drug cannot enter into the bacterial cell. So decrease in bacterial permeability is another cause of bacterial resistance. Then the bacteria may develop a mechanism to destroy or inactivate the sulfur drug. So if that occurs, the bacteria develops increased ability to destroy or inactivate sulfonamides, then that will be also a cause of resistance. And sometimes there is altered dihydrofolate reductase due to mutation, chromosomal mutation. So there will be mutation in this enzyme, folate reductase and or dihydrofolate reductase. This is the same enzyme, only the nomenclature is different because of the substrate. Here folic acid is the substrate, so folate reductase. Here dihydrofolic acid is the substrate, so dihydrofolate reductase. So when there is mutation of this the gene responsible for this enzyme, that also can cause resistance. So these are all mechanisms of bacterial resistance. Thank you.